this video, we're going to share some recommendations for some things that you might want to consider before and during any of your healthcare appointments with patients who have a learning disability. Health inequalities are common in people with a learning disability. Many people with a learning disability experience poorer health and die at a younger age compared to those without learning disabilities. Importantly, a high proportion of these health inequalities and premature deaths are avoidable. Furthermore, people with a learning disability are less likely to receive the same standards of healthcare compared to people who don't have a learning disability. This might include typical health checkups such as cancer screening or dental checkups.
With the aim of reducing these health inequalities, the National Institute for Health and Care Excellence has recommended that everyone with a learning disability should be offered an annual health check. However, a large percentage of people with a learning disability are still not receiving an annual health check, and this could be as many as 45%. It's therefore important to understand the barriers that might stop people with a learning disability from getting the care that they need. Some common barriers include patients not yet being identified as having a learning disability, healthcare staff having little understanding of learning disability, failing to recognise that a person with a learning disability is unwell, failing to make a correct diagnosis, experiencing anxiety or a lack of confidence around learning disabilities, and poor communication between different healthcare providers, such as when referrals are made.
Having highlighted some of the health inequalities and some of the barriers to receiving timely and effective healthcare, we have set out some recommendations for healthcare professionals. First of all, we recommend that the healthcare professional familiarises themselves with the patient with a learning disability. Check if they have a formal diagnosis and check relevant websites to gain a better understanding of that diagnosis. For example, many genetic syndromes have a corresponding website with lots of information about diagnosis, behaviours, health problems, and other information that may be beneficial for the patients, their families, their carers, and the healthcare professionals that see them. The MenCap website is an excellent resource that has a wealth of information about learning disability, including scientific references and statistics regarding learning disability in the UK.
Secondly, we recommend that you consider how to communicate effectively with people with a learning disability. Is your patient non-verbal, or do they have very few words? Is it possible that they can use alternative communication strategies such as sign language or Makaton? The charity Cerebra have a comprehensive guide on how to communicate with children who have a severe or profound intellectual disability, which you can download by accessing the Cerebra website. This may also be useful to share with parents and carers.
Our third recommendation is that during your appointment preparation, you might consider how you can help the family to prepare for any health-related interactions that they might have with other providers, because referrals and hospital appointments are common. Communication passports are a useful tool because they condense all of the information about that person with the learning disability that might be useful for other healthcare providers to know, such as their likes and dislikes, how they communicate, how best to communicate with them, and medical information, including the type of medications that they are taking.
Our fourth recommendation is to consider whether any reasonable adjustments need to be made before or during the appointment. Consider access to the appointment location, including parking or wheelchair access. Do you need to provide equipment such as hearing aids? Do you need to provide accessible resources, such as resources for those who are hearing or sight impaired, like braille copies of information leaflets? We recognise that you may not have time to implement all of these recommendations in one go, but even if you can implement just one, this would make a difference.